Chapter 5. Mesopotamia: Laws, Diagnosis, and Early Doctors. Night falls over Mesopotamia. The city slows down. Oil lamps glow. Bricks still hold the heat of the day. Somewhere between the rivers, people worry about sickness. This is not a wild, ritual-only world anymore. This is an organized one. Rules exist. Records exist. And medicine is starting to look official. Welcome to Mesopotamia, land of Sumerians, Babylonians, and some very serious early doctors. Organized medical practice. Mesopotamia did not treat healing as random magic. It was structured, almost bureaucratic. Doctors were trained. Knowledge was written down on clay tablets. Symptoms were listed. Treatments were noted. Outcomes were observed. Healing became a profession, not just a calling. If someone said, "I am a healer," people asked, "Okay, but which kind?" There were rules, there were expectations, and yes, there were consequences. Medicine here was not just about curing disease, it was about responsibility. Babylonian and Sumerian medicine. Sumerians came first. They laid the foundation. Babylonians refined it. Both cultures believed illness came from gods, spirits, or broken divine order. But they also believed the body followed patterns. They named diseases. They described pain, swelling, fever, wounds, and strange behavior. They wrote these things down. Tablets listed conditions like head pain, chest tightness, skin lesions, digestive problems. It was not modern science, but it was observation-based. A sick person was examined carefully. Eyes, skin, breath, speech, all checked. Nothing was rushed. This was slow medicine. Very slow, very serious. Diagnosis based on symptoms and omens. Diagnosis came from two directions. First, symptoms. What hurts? Where? How long? Does it come and go? Does the patient speak clearly or not? Second, omens. A lot of omens. Doctors looked at dreams, time of illness, sudden events, unusual signs in nature. If a patient fell sick after angering a god, that mattered. If the illness started on a certain day, that mattered too. To them, disease was a message, not just a malfunction. So diagnosis became a mix of logic and belief. Body signs plus divine hints. Not perfect, but surprisingly systematic. Code of Hammurabi and medical accountability. Now comes the scary part for doctors. The Code of Hammurabi. This law code did not play around. It covered medicine in detail. If a doctor treated a noble and failed badly, his hands could be cut off. Yes, hands. If a doctor cured someone successfully, he was rewarded. Silver, respect, status. If he failed, especially with surgery, punishment followed. Harsh punishment.